Hey guys, welcome to the second part of month 9, the core strengthening class for Mosaic Wellness University. Core strength, guys, has been something of a missing link when it comes to fitness and exercise. The reason why people have paid so little attention to it is that there's nothing flashy or glamorous about it. Although it involves the abs, core strength is nothing about having a visible six-pack or a flat stomach. And while the core muscles as stabilizers can help determine how far you can throw a ball, their development is often secondary to the other more obvious and more visible muscles in your limbs. The only people who have had the right idea about core strength all this time are dancers and yoga practitioners. They've developed their core as part of their training, and it shows. Professional dancers and yogis generally stay fit into their old age. They stand straighter and have more energy at a time when many of their peers can just hobble along. The core muscles also make it possible to stand upright and to move on 2 feet. These muscles help control movements, transfer energy, shift body weight, and move in any direction. A strong core distributes the stresses of weight bearing and protects the back. There are over 35 muscles involved in your core strength. However, we are going to concentrate during this class on the muscles that give your lumbar spine or foundation stability. Lumbar core instability is responsible for the majority of lower back injuries. Lower back pain is among the most common muscular and skeletal troubles worldwide from which people are suffering and is the most common musculoskeletal problem in Canada. According to research from the United Nations, more than 85% of people will suffer from lower back pain during their lifetime, and many of those sufferers eventually undergo expensive and unnecessary surgery that leads to permanent core instability. So what is your core? Your lumbar core is the group of muscles of your trunk that stabilize every spinal joint and coordinate all normal movements of the spine. Core strengthening allows you to strengthen and stabilize your spine by strengthening the core muscles, co-activate muscle groups, and develop the proper neurological memory. Oops, sorry about that. Take the example of learning to play the piano. There are many skills you can learn when you begin to play. Number 1, strengthening of the muscles, which is playing and doing exercises to stretch and strengthen the muscles of your fingers and hands. Then there's number 2, co-activation of muscles, getting them to work together with perfect timing, learning to get your fingers to work together, particularly the right and left hands, and opposite hands doing different things at the same time. Creating new neurological pathways is the third one, or patterns. And once you've played a piece over and over and over in practice, eventually the song is played by memory and reading the music is unnecessary. This is exactly what we gain by doing core strengthening exercises. So what are the core muscles? In lumbar core conditioning, we focus on the following 3 muscles: the rectus abdominis, we focus on the transverse abdominis, and the multifidus muscles. So the rectus abdominis is right here. You'll see the cursor move, I hope. It's that long muscle in the picture on the right. It's that long area of muscle that gives that impression of a six-pack, the rectus abdominis. The transverse abdominis is through here. And then the multifidus are the muscles in the back part of the body. So here's another view of your core muscles. Imagine you're cutting yourself in half like the magician in a magic show, and you're looking down at the core muscle groups. Notice that they form a perfect girdle around your spine, stabilizing all the joint movements. So you can see them there, the rectus abdominis, etc. So there's that rectus abdominis, transverse abdominis, and multifidus. And all of these are muscle tests that I can check for in the office to see whether they're turned on and to see whether they're strong. Your core muscles are your first line of defense against spinal injury. The core muscles are short muscles that often cross only 1 or 2 joints. This design prevents disc and ligament injuries because the core muscles control movements of your trunk, restricting any excess of motion that tear and damage the discs and ligaments. However, if the muscles are not strong enough to stabilize a movement, then the ligaments become your last protection against damage to your spinal joints. And this is what actually sets you up for disc injuries in the lower back or the neck, or problems where the back gives out doing very simple activities. Weak core muscles lead to ligament injuries, particularly in the case of the lumbar spine and then the discs. Co-activation of core muscles. Research reveals that most all lower back pain sufferers have a neurological inability to signal the core muscles. With nerve interference, the core muscles are unable to stabilize and protect your spinal joints. This is very important because there needs to be an aspect of timing or synergy or co-contraction of the core muscles, and it's critical to preparing your trunk for normal movement. And the current theory suggests that this co-activation problem stems from a disruption in the communication between the brain and the core muscles. And guys, that's what chiropractic is all about. Chiropractic is all about this idea of trying to maintain a spinal system that protects your nervous system but doesn't interfere with it. So I know this is a bit technical, but I want to kind of go through this to try and help you understand what's going on. So what happens is there are different nerves. On the left side of this diagram here, you see the brain and the body. You see autonomic nerves in red that go to organs, glands, blood vessels. Then you see the motor nerves that go to the muscles. These motor nerves make up almost half of the body, and motor control is dependent on sensory input. So the sensory input in green here is pain, temperature, vibration, sight, hearing. These are all the sensory aspects of what goes on. So we call, so motor control is based on the sensory aspect. The contribution of muscle force to control motion is dependent on optimal control of the nervous system. Guys, this is about research. Let's break it down into plain English again. So guys, so core instability is a nerve problem first. If the nervous system is unable to communicate with the brain properly, or the brain is unable to signal the muscles, then muscle training and co-activation of muscle groups becomes impossible. And guys, if you know me in the clinic, this is what I do when I do the muscle testing to try and understand whether or not there's communication between the brain and the muscle. The experiments that I'll do with patients, especially during the first initial phases of their care, is to demonstrate to them that if we work a muscle that's weak in a muscle test, it does become strong. However, under load, it blows out again and becomes weak until we adjust on the Pro Adjuster or by hand to change the position of the vertebra and therefore the resulting effect of that vertebral segment on the nervous system and its negative impact on it by putting it back into a proper place, and the muscle stays strong. Guys, this is something that I just cannot impart to you enough, or to help you try and understand and really focus on this. It is critical to your understanding. And here's the deal. When there's a problem in a muscle test where the spinal segment to that muscle is implicating a problem to that nerve, the organ and the gland from that level will also be implied. And as a result, there'll be a decrease in function in that organ and gland, and therefore the ability of that organ and gland to handle the stresses that our life has for it. What ends up happening is the organ begins to break down, and eventually we have an organ challenge. Guys, I cannot tell you how important this is. And here it is showing up again in this particular description. Because your nervous system, guys, is a two-way communication system, and both the incoming sensory messages and the outgoing motor messages to the muscles or to the organs as well have to be sent without restriction of interference. Your sensory nerve carries signals from your joints, muscles, and ligaments that give your brain a constant image of your movements. Your brain can then instantly adapt to these movements by sending appropriate signals to your muscles to create well-timed contractions and coordinate the different muscles to work together in harmony. The problem arises when either the sensory side or the motor side becomes interfered with. We call this type of nerve interference subluxation. Subluxation causes interference to both sensory nerves and motor nerves, resulting in an inadequate activation of muscle groups and uncoordinated muscle contractions. As you might have already figured out, this is step one in core strengthening. Without an optimally functioning nervous system, core strengthening alone would be a waste of time if there is no valid muscle co-activation, timing, and synergy occurring to create positive neurological memory. You just can't turn the light on if the power to the light isn't actively sending electrical signals to that light. You see, just like learning to play the piano, if your core muscles can't be trained to learn the song until it is memorized and the movements become a neurological habit pattern that happens without any hesitation, then core training is a waste of time. And here's an MR study of the multifidus muscle. Okay, what we're seeing, and what happens to core muscles with an extreme nerve problem. So on the top left illustration is an MRI of a normal side. On the bottom right is a damaged and unstable lower back, and the muscle is affected. They're smaller fibers, and they're not as
as strong as they should be. You can see the difference between them, how large and black these areas are in the top left, but how white and small they are in the bottom right. The MRI in the bottom right is a year after lower back surgery. So due to nerve damage and disuse, the muscles have atrophied and provide little or no support. And guys, this is why so many people continue to have continued problems after lower back surgery. So how to strengthen and train your core? Well, first of all, the first thing is to reestablish normal nerve supply with chiropractic adjustments. And we do that, guys, with a pro adjuster and with the muscle testing. We also do it by evaluating and analyzing your spine through the neurospinal functional index and follow your scores. We perform specific exercises designed to strengthen and co-activate your core muscles. And then number 3, we develop neurological patterns or memory so that your brain remembers instantly the stabilization process. Okay. So why a core ball? It strengthens the core muscles. It practices co-activating the core muscles and synchronizing the timing of muscle contractions. It creates that memory of what we want to see happen. It requires a very high demand on the sensory and motor nervous system due to being performed on a moving or unsteady surface. So the body has to be able to coordinate itself when it tries to balance itself. This is key to successful core training. But there also needs to be some safety. Okay? First of all, it needs to be inflated properly. The more firm the ball is, the more wobbly it will be. The more wobbly it will be because it creates a smaller footprint. The looser the ball, the bigger the footprint, and the more stability the ball will have. A loose inflation may be better for a beginner, and then adding air later to make it more difficult. We want to use a burst-resistant core ball. When exercising, move any objects that might harm you or the ball. Remove sharp objects such as jewelry and belts. You need to warm up with some seated rolls. Just sit on the ball for a minute or so and do clockwise and then counterclockwise rotations while sitting. I call this the Elvis. And stop immediately if you feel any pain or discomfort. But as you do that, you need to start the exercise at the easiest level before going to higher levels. And the quality of the exercise is more important than the quantity. So what are the core exercises? Abdominal hollowing, back extensions, and curl-ups. These are the 3 things, the main ones that we're going to be wanting to promote. And if you're interested in these, we can talk about these in the clinic too as well. We have a ball in the clinic and we can demonstrate these for you. We can also get you a ball. In a landmark study done by one of the world's prominent orthopedic researchers, Dr. Bogduck looked at thousands of studies involving the medical treatment of chronic lower back pain. He found no data from any of the studies to support lower back surgery, electrical spinal cord stimulation, epidural steroid shots, or intraspinal opioid shots, acupuncture, trigger point injections, traction massage, back schools, NSAIDs, or pain medications. The only approach to chronic lower back pain shown to have produced substantial and long-lasting reductions in chronic lower back pain were exercises designed to co-activate the lumbar core muscles. He never looked at specific chiropractic adjustments to store the neurological connections first, but that's what we know will work as it adds to these particular exercises. So the only treatment in the study shown in the controlled trial to produce substantial and lasting reductions in chronic low back pain with a specific exercise is designed to co-activate abdominal muscles and the multifidus. So guys, here's what they look like. Abdominal hollowing. You begin with a 4-point stance, kneeling on the hands and knees. You need to suck in your belly, bring your belly button up towards your spine, so suck your stomach away from your belt. Extend one leg and the opposite arm and hold and balance. And then you switch to the opposite side. Back extensions are done on the ball, where you begin on your knees with hands behind your head and the head and the upper body flexed over the ball, as is in this top picture. Then you lift your head and your upper body so that the lower body is parallel to the ground. Hold your head and upper body parallel to the ground with each repetition for 2 seconds, and you repeat that 5 times. Curl-ups. This exercise is primarily for the abdominal muscles, but it is performed on a moving surface, so the transverse abdominis co-activate to maintain your balance. This is what we want to see. You need to start with your spine inclined position on the ball. Walk your body away from the ball until the ball is positioned under your lumbar spine. Your head and shoulders should be off the ball in a straight line with the body, as it is here in the top picture. Place your hands across your chest or fingers behind your ears. Drop your chin to your chest slightly and curl up. Hold for 2 seconds. Slowly lower the back down and repeat 5 to 15 times. So you see how the ball here is in the lower back. See how it's able to support the lower back and the spine by being where the bum kind of sits in the front part of the ball. Then you see it move to the back part. So in conclusion, the prevention of chronic spinal injuries is dependent upon a strong core. And a well-conditioned and balanced core requires any optimally functioning nervous system and strong core muscles. So the first step is to make sure that the power is on from the switch, which is the spine, to the muscle. We do that through the muscle testing, and then we get involved in activating the core. Guys, it's a pleasure to be doing this program for you. Congratulations on finishing month number 9. If you have any questions, again, do not be afraid to call at 905-629-0688 or to email me at Dr. Dave, that's DRD